So I get the question all the time, should I taper off of a substance or should I cold turkey off of a substance? Now that all comes down to whatever the substance is. Now, a follow-up from the video last night, I'm just going to start with this substance. We're going to be covering some different substances in regards to if you should taper or cold turkey, but always talk to a healthcare provider. This is for educational purposes. This is things as a psych RN that I've seen in the psych setting and what doctors have recommended, and just from experiences I've seen as well, and from what you can just look up online as well. So let's start with the first substance of methamphetamine. Check out that video I did last night in regards to how the withdrawal of methamphetamine, some things that can help with it, and even just some potential medications in the future that could help as well. But anyway, for methamphetamine, if you are, and once again, if you are shooting it, going cold turkey off it is going to be very, very hard, but still can be done. It still can be done if, once again, if you have a bed, if you have vitamins, if you have access to water. And I know you might go, what, have access to water? Yeah, people today don't have access to water. Unfortunately, since the year of what happened in 2020, a lot of people, the post effect from it has been really rough, and there's a lot of homeless people today that even having access to water can be tough. So, but if you have a bed, you have water, you can, but it's still going to be really hard. What I would recommend potentially would be going from shooting it over a 2-week period to potentially, if you progressed from, let's just say, snorting it or smoking it to injecting, reversing that. So going from the injecting to snorting to smoking and tapering it. Reason being for that is, once again, methamphetamine is one of those things that it's hard to overdose on it and it be fatal. And once again, that is if it is methamphetamine by itself. That's assuming you're not using alcohol or other substances with it. But I'll go into polysubstance as well if you're using multiple, how you could do that. But by itself, if you've been shooting it, tapering it. If you've been smoking it or snorting it, tapering it as well over a 2-week period, because once again, when you get off of it completely, it'll make that a little bit easier. Now I know there'll be people that'll go, oh no, you're just prolonging the withdrawal from it. Maybe, maybe not. It won't be near as intense if you do it this way, and you won't get the desired effect that you were getting potentially from it. But you got to realize, if people are to the point to where they're shooting it daily, they're just using that to feel normal. There's not a high affiliated with it at that point. So tapering it, just because there's not a potential to, if you quit cold turkey on meth, you can do it. But if the reason why tapering is a better idea is just long-term sobriety on being off of it. And also, once again, no risk of seizures, which leads into the next let's just go into the next set of medications, which is benzos. Xanax, Valium, Ativan, Klonopin. If you're taking those kind of medications and you've been taking them for, I'm going to go at the lowest from what I've seen, from 6 months on. If you've been taking, let's just throw out, for example, let's start with clonazepam or even Ativan, because the dosing is pretty similar. If you've been taking 1 milligram twice a day or 3 times a day for 6 months to a year, Klonopin or Ativan, you're gonna have a withdrawal. And also, if you stop it all at once, if you've been taking 3 milligrams of it, or even 1.5 milligrams or more on it daily, there is a chance of developing potential seizures, because your anxiety is going to skyrocket if you cold turkey it, which some people can. But once again, this is why you talk to your doctor. And if you have a good doctor in regards to using benzos, and if you're not supposed to be abusing them, but if you're trying to get off of them, regardless of the circumstances that are dealt to you, they should be tapering you. They should never just be cold turkey it, because the risk of seizures are a lot higher. And a lot of times, people who take benzos as it is have other conditions going on. Some people have epilepsy. Some people have seizure disorders. So going on, and they take it for anxiety and helping reduce seizures, because people who have epilepsy and stuff, sometimes the only way to control a seizure or epilepsy is you have to give them a benzo to help, reduce essentially the electrical activity going on in your brain. It's overstimulating, so you've got to bring it back down to a neutral state. In order to do that, you've got to give the patient a benzo. So if you just pull that stimulus away, if you pull that away from somebody all at once, you can have rebound seizures. So if you've been taking that, and if you don't even, and let's just say you don't even know you have a condition of seizures and you just go cold turkey, you do have the risk of that. Also, if you're going through withdrawal and you're driving on benzos, risk of having a seizure. So my advice, never ever cold turkey benzos, ever, unless your doctor directs you to. But that, if they did that, even if you were abusing them, they still shouldn't be doing that because of the risk of seizures. So benzos, my opinion, taper. Most medications taper. Those are the first two, so methamphetamine and benzos. Let's go to alcohol now. Alcohol, another one, taper. If you've been drinking daily and you pull that away and you don't have any assistance, you have the risk of developing delirium tremens, which I'll link a video at the very end as well on what that is, where you can develop a state of psychosis, hallucinations, you think you've got bed bugs, you feel like you want to rip your skin off, you think there's stuff on the walls, you get very confused. It's very scary. I've seen it so many times in this inpatient detox setting. It's very scary. Now, one thing that people use to treat alcohol withdrawal, and this is if you're in the inpatient setting, is benzos to help with the seizures. So with that, if you're at home, and that would be if you were in the inpatient setting and you're taking alcohol away, right? You're taking it away completely. You could say, oh, I can cold turkey it. Well, in the psych setting, yeah, you would, but you'd also be under the doctor's advice, and you'd be taking a benzo to eliminate seizures, to eliminate really bad muscle spasms and rigidity, to where, that and not being able to sleep, you'd be given a lot of times things like Phenergan or promethazine, which is something that really helps with nausea and can also really help people who have really bad muscle cramps, and muscle relaxers like Flexeril, Xanaflex. Things like this are given in the psych setting when detoxing off of alcohol. If you're at home and you're wanting to get off of alcohol, don't get mad at me for saying this, anyone hearing this who's got a loved one drinking, they should be tapering off of it. So if they're taking 12, 13 shots of 80 proof a day, or more, over a 2 or 3 week stretch, they should taper that down, bring it down, instead of just cutting it all off unless you're going into the psychiatric setting. Reason being, not seizures. And a lot of times, remember, people who've been drinking chronically you also already have a lot of central nervous system disorders potentially. You have nerve issues, you have muscle spasms, you have liver disorders, you have hepatitis to deal with, polysubstance orders potentially to deal with. So if you just cut that off, you run the risk, if you've been drinking for, I'm just going to throw out 6 months or more again, of having some serious problems. And I'm just getting straight to the fact on this. That's why with this, once again, tapering down. Do not ever, if you've been drinking a long time and you're going off it at home, don't ever stop abruptly. That's alcohol. Now let's go on to heroin. Or we can even go on that end. We can talk about Oxycontin, hydrocodone, things of that nature, pain medications. I'm going to leave Ultram or Tramadol out of this. I've got other videos on that which I can link for you as well. See, this channel covers pretty much everything. We cover all of it. All mental health related, even medications not mental health related. We cover everything mental health related. So yeah, like and subscribe, leave a comment on something you've had to taper off of. Let's continue on. And we don't really do any editing either. That's how, I'm just going to be honest, I don't do editing and stuff because it looks fake if you're doing editing. I'm the real deal when it comes to this, and I'm not trying to be cocky. I've seen this over and over and over again. I'm not a doctor, I'm a nurse. Okay, pain medications. Let's check that one off. Now with pain medications, this is the one where you can taper or cold turkey. A lot of times, if you're abusing them, what they will automatically do let's say you run out, you're just going to have to go through the withdrawal. If you're using something like heroin where you're shooting heroin or snorting Roxys or whatnot, and if you have the option, and let's start with heroin first. I would never try, first off, this is the one thing I'll say. With heroin, I would never try to taper off of heroin if you were shooting it. And being like, I'm just going to shoot a little bit less each time. I'm going to shoot a little bit less in the arm. No, because depending on the dose, on what you're getting, you don't know if it's laced or not. Same with the pills. The only way I would potentially consider tapering off of the pills is if it's the same batch you've been using that you got from your plug, and if you were snorting it, and then you want to go from there to just taking it by mouth but using a lower dose over a week period, that's fine. But if you're getting a new batch and wanting to taper off of that compared to the last, I would not do that because you just don't know if it's been laced. That's the biggest problem in my opinion. So yeah, if I were you, do not at all try to taper off of it if you have a new dose of whatever. Got a hair in the back of my mouth. Anyway, don't taper unless it's the same dose. You're going to have to cold turkey it. And cold turkeying something like, and I know I got crap on one with fentanyl and whatnot. People who say you don't have stomach cramps, where there's not a bad post-acute withdrawal, they're lying. And here's the other thing. Depending on the person, the physical withdrawal sometimes isn't as bad as the post-acute withdrawal, which is the mental cravings. I've seen this plenty of times, and this is even people who shoot it. Yeah, there's flu-like symptoms. And what I mean by flu-like symptoms, it's different for everyone. Everyone has different pain tolerances, thresholds. Some people, when they go through opioid withdrawal, they don't vomit, they don't throw up, they don't have diarrhea. Actually, well, diarrhea, that is pretty, most people do. But when it comes to nausea, vomiting, a lot of people are different. Some people don't have that at all. Some people it'll be harder for. Some people it'll be harder for that don't shoot it compared to somebody who's just taking it by mouth. But the general rule though is, or even snorting it, the general rule in regards to getting off of painkillers, and this is just the general rule, the younger you can get off of those that you've been abusing, the better, because your metabolism naturally works a lot better. When people get in their 40s, 50s and onward and they try to quit, they still can quit, but it's going to take a lot longer to go through the withdrawal because your body, a lot of times, you're just older. Your body absorbs, processes things at a slower rate than somebody who's younger, a teenager or somebody up into their mid to late 30s or early 40s. But on those, I would cold turkey just because of the risk of overdosing a little bit more. The reason why I said with alcohol tapering, it's because if you're going to buy alcohol, you know it's not laced with something. That's assuming you're just buying it at like a liquor store or something. Not like at a bar where it could be roofied or whatnot. Now, outside of that, this is the big one. Now let's go into polysubstance. So let's say, for example, you were using methamphetamine, okay, methamphetamine, you were drinking alcohol, right? And let's just say smoking weed, those three, right? So upper, which is meth, downer, which is a benzo, or no, upper, which is meth, you're drinking, let's not do the benzo one, upper, you're using meth, you're drinking to try to sleep, then you're using cannabis. How I would attack that kind of polysubstance use is always attack the ones at first that you can cut technically cold turkey, or one where you risk the threat of seizures. So with this, you could cut the cannabis, obviously. You could cut the meth or taper it, get that down as low as you can, and then attack the alcohol. However, you can attack all of them at once, but the reason why you could taper, what you could do is you could cut the cannabis completely. The meth you start tapering and the alcohol you start tapering, but the key is don't ever stop the downer cold turkey when you're using polysubstance. If you're gonna detox them, taking them all away at once it's just a recipe, unfortunately, for disaster, unless you're in a psych hospital where you can get the medication assisted treatment you need under medical supervision. Another one, let's say you're using heroin, meth, and a benzo, okay? And a benzo on that. What I would do in that situation is, if you have barely, the heroin, I just cut cold turkey. Don't risk tapering it unless it's from that same batch. If it's in the same batch and you want to taper it, that's fine, but don't go out and buy more. That's one thing you need to cut cold turkey because of You don't know what's in it if it's laced. Again, with that, the meth and the benzo. So you would cut the heroin, then you've got the meth and the benzo to worry about. So cut that dose that cut the heroin down. Let's say you have like a week's worth left. Taper that. You're done with that. A quick taper, or you stop it cold turkey. Then the meth and the benzo are the things you're dealing with. Together now. What I would do is you could cut the meth at a faster rate than the benzo. You could taper off the meth a little bit faster, and the benzo you wouldn't want to taper off as well. Don't stop that one cold turkey because of the seizure risk. But however you feel more comfortable lowering the benzo down at a faster rate. But let's say your benzo gets cut off. Let's say your plug for getting the benzo you don't have access to anymore, and you have 3 or 4 days left. Try to drag out those doses to where you're cutting them in half and half and half and half. So when you do have to go cold turkey on that, you lower the risk of seizures and other side effects. So the whole thing to take from this is the benzos and the alcohol. You do not want to stop cold turkey unless you're in a psych hospital or under doctor's supervision. That is what I would say on that. The other ones you can cut at your own rate. The heroin as well. If you're almost out of it, do not go risk buying a new batch. Just cut that cold turkey unless you have the same batch and you know it's not laced, which unfortunately people go through that stuff like crazy. If it's from the same batch, okay, you can taper it low, because you can taper it down, but don't go buy more. And then meth, you can cut cold turkey, but you can also draw that one out as well. You can draw out all these. The main one is the heroin that you want to make sure that you cut cold turkey. You can cut cold turkey all at once. Meth you can, but the benzo and the alcohol are the keys to where just make sure you taper off. That is your daily dose of mental health. Once again, these videos are for educational purposes only, and I know they can be uncomfortable videos for some of you to watch. I understand that. You don't have to watch them. But unfortunately, ever since the year 2020, if you look at the stats, drug use is just skyrocketing. More homeless people as well. Even today, people can't even have conversations with each other anymore, I feel like, without wanting to kill each other. Don't actually mean that, but you know what I mean, metaphorically. But drug use, it's getting out of control. And these are conversations that need to be talked about more and more. And unfortunately, a lot of times people just don't know what to do, and they just have no plan on stopping. And this is ways, if you actually want to get off of them, you can utilize what you're using to get off in a way to where you can have some long-term success. That is your daily dose of mental health. Once again, I work as a psychiatric RN in an inpatient setting. This is stuff I've seen firsthand, talked to a lot of addicts as well. I know a lot of addicts. I've seen it. So what I'm telling you, just so you know, I'm not just reading off of something. This is based off of experience, what I'm telling you, okay? Off of experience, I'm telling you what I've seen, okay? Sure, I've not went through heroin withdrawal or meth withdrawal, but I've talked to these type of people all the time. And the thing is, people don't realize about addicts. The number one thing I want people to know who aren't addicted, or you jump to just assuming, or, oh, they're just an addict. You can say that, but they're some of the smartest people out there, and some people that they're incredibly smart, and they've been through either trauma, they didn't fit in, or something else. But they're some of the smartest people, and could make changes in this world. They just need a little bit of help, and they need people to be more accepting about addiction. Like, subscribe, comment. That is your daily dose of mental health. I love you all. Once again, we'll cover everything. We covered Ozempic a couple weeks ago. We cover everything from a mental health and physical health standpoint. Have a good day.